Could artificial intelligence be used to streamline care for those battling addiction?
Researchers at UW say it can, and it could also mean fewer hospital visits. Arman Rahman shows us how.
Doctors and researchers at UW Health are hoping artificial intelligence can be a tool to make sure those struggling with opioid use disorder don't fall through the cracks.
The medical chart is full of information and it's overwhelming, and our human brains just can't process everything.
So sometimes Dr. Majid Afshar says patients that should be prioritized aren't.
A lot of times we think of these problems in the beginning and then we kind of deal with other things like a broken bone or an infected wound, but the underlying problem that led to this condition, having had an opioid use disorder, was never really addressed.
Now the new AI algorithm his team developed can scan through clinical notes, medical history, and other health records in seconds for certain patterns associated with opioid use disorder. If it finds them, the next time the patient's chart is opened, an alert pops up.
Hey, your patient may be at risk for an opioid disorder. Would you consider an addiction medicine consult?
Patients identified by AI screening who got consultations were 47% less likely to go back to the hospital within 30 days. Dr. Afshar says that's because the tool nudges the doctor to think about withdrawal and what care the patient can get outside the hospital.
Give them Narcan and fentanyl test strips and other things that are beyond just the medications that we give for opioid use disorder.
But machines can make mistakes.
Having a cool little AI assistant next to you to help you make the right decisions, but ultimately the clinician's making the decisions.
Dr. Afshar says UW has a committee that reviews AI software so patients aren't misidentified.
It looks at safety metrics and is it biasing against the patients? Is it causing harm? And we continually review and monitor it.
He hopes the tool can be used for other types of conditions in the future.
What if we can also help the clinicians figure out when to treat them and how to treat them?
Reporting in Madison, Arman Rahman, News 3 Now.
Arman, thank you. The study was funded by the National Institutes of Health as well as the National Institute on Drug Abuse.